Hi, welcome to Grace and Grit Homestead. I'm Jules and I am a nurse. I thought it would be a good idea. I just got off work and the girls I work with said, well, it would be a good idea if you show people as a nurse what you keep on hand for a first aid kit. You know, things that as a nurse I use on a daily basis when I'm at work, things I use around the house, things that I feel like will be the most used and the most important. This is not going in depth like a major trauma kit or anything like that. It is what I consider my basic first aid. I have things in another kit from not steri strips, but from sutures to cat T tourniquets, just, but this is going to be basic. And I've got to get me a better bag. This is a Mary Kay makeup bag, but I tell you why I put it in here. Because you can open it up like this, and you can hang it. And I usually have this hanging in my closet. And so I think this is pretty neat. You can also take these off if you just need to grab one thing. So I kind of like it. I need to come up with a bigger version of this. Anyway, one of the first things I have, and I keep this in my car. I have some wound cleansing spray. This is real good for cleansing wounds out. I have some hydrogen peroxide if I need to actually boil a wound out. You never want to put hydrogen peroxide on a wound except for when something, you first have it and you need to boil it out. Hydrogen peroxide can take away the good tissue along with the bad stuff, so you don't want to keep on using it over and over again. I have some gel, aloe vera gel for sunburns in case we get sunburned at the lake or whatever. And so the main things with this, I would say that I would use more than anything would probably be the wound cleanser for spraying cuts and abrasions to cleaning out a wound. All right, in this little pouch, I have a N95 mask. I've got some different size Band-Aids. I have a cotton tip applicator for doing steri strips if I'm trying to get skin back where it goes to steri strip it. I'm going to need one of these. Or, I may have somebody may have something in their eye that I may need to get out. This, I've just got some gloves and just a regular mask. And this is probably one of the most important little kits in here as far as I'm concerned. I have benzoid tincture. Benzoid tincture is what you use on the skin when you have a skin tear and you're going to use steri strips, or anytime you're using steri strips, you apply this benzoid tincture to the skin, like right here. You'd apply it to the skin on the outside of where the wound is, because this is going to help these steri strips to really stick. It is very sticky. In fact, I have a funny story. When I was a fairly new nurse, I worked at a doctor's office, Dr. Reed in Ardmore, and he told me to go get some iodine because he was going to do a procedure on this man's head and remove some little skin cancers. Well, iodine and benzoid tincture looks identical in color. Well, needless to say, instead of grabbing the iodine, I grabbed the benzoid tincture and I went to putting it on all these places on his head. And when Dr. Reed came in there and went to, get him off, he's like, why is this so sticky? And then he started laughing. He said, you grabbed the benzoid tincture instead of the iodine. And that's exactly what I did. I like to never got all the yellow, orange, sticky stuff out of that man's head. But that was definitely a learning experience. So don't put this in your head. It's not iodine. I have some stop bleed for stopping bleeds. Have more steri strips, more Band-Aids. I have alcohol pads. I have lubricating jelly. I have skin prep. If you do not have benzoid tincture, skin prep is really good to, same thing, go around the outside of the wound to help the steri strips to stick. I have got actual iodine pads, and more, just some more, a little bit of this and that, antibiotic ointments and all kinds of stuff like that. But that's mainly to like for closing a wound without using sutures. And I'm always banging myself up. I'm sure at some point in time I could show y'all how to apply steri strips, because I'm always bumping my skin and messing it up. In here I have, well, this probably really belongs in my suture kit, or, well, you never know what I might use it for. I've got some lidocaine and some needles for numbing. I've got some grips and some scissors, a syringe. I have a pen light for doing neuro checks, and that's when somebody falls and hits their head real hard. You're going to do a neuro check and check the size of their pupils and stuff. I won't go into all the detail, but anyway, this pen light is good for that. Got some more scissors. I've got some fingernail clippers and some other nail clippers that work real good for really thick toenails. I'm not sure exactly why I put that in there. I have just a regular tourniquet. You know, if I needed to suddenly, needed to kind of put some pressure or apply a tourniquet, I've got one of these until I can get to the bigger kit or whatever. Okay, let's see, let's move it on over here. I'm sorry, I've got junk scattered everywhere. I have another very important thing, because wounds is probably one of the main things we deal with. Sometimes with elderly people, their skin is so fragile that you don't want to put tape on their skin. So say you've got something that needs a dressing on it, and say I wanted to put, I'll show you. Say I wanted to put, say I needed to put an actual dressing over an elderly person's skin tear or wound. I would take like a non-telfa dressing, put it over there, and then I would wrap it with this rolled gauze, wrap it around, and instead of putting tape to the skin, I would use the tape, which I have plenty of tape. I would use the tape and just tape the rolled gauze down, and it would hold it in place. That way you're not having to pull tape off of their skin. Plus, it can be used for many other things. I have more tape. I have a ABD pad. This is good for putting over wounds. I have just some small 2x2 sterile gauze sponges. I have a composition wound dressing. It's just basically padded in the middle, and it's got like the Me-Fix tape around the edges. That's also good for wounds. I have some sterile 4x4s. I even have some honey. It's a honey dressing is what it is, and it helps in wound healing. I have a split gauze. If someone had a G-tube and say I needed to clean around it or it was bleeding, this is split in the middle, so it'll go right around the little tube. I have another tourniquet. This is real good for like if you've drawn blood or you need to apply pressure. This adhesive wrap is real good for that. It's smaller size, good for wrapping toes and fingers. Got a ace wrap. And then in here, I have itch stop cream. I have a bottle of Tylenol, a bottle of ibuprofen. I have some electrolyte drink mix, some triple antibiotic ointment, more lidocaine. Very, very important. This is silver, I can't say it, silver, help me out, Kara.
Silverdine.
Oh yeah, we call it Silverdine, but the medical name, I can't say that. We just call it Silverdine. Anyway, this is a burn cream, and that is very important if you have a burn. Have a syringe and needle if I was gonna give some type of IM shot. I have antifungal cream. This is good for like athlete's foot. I have antibiotic eardrops. I'm sorry. This is antibiotic eye drops. This is gentamicin. This is some eardrops for earaches. And then I have the old Ambisol for toothache pain. And I even have a couple of albuterol breathing treatments in here. Anyway, that's just kind of a quick rundown of what I have that I kind of keep in my car. And I usually also keep a stethoscope and a blood pressure cuff and a pulse oximeter, a thermometer. But I really need a lot bigger bag. But as far as supplies for any emergencies, the most common emergencies that you may have, I would say this is it. Anyway, I hope you learned something from this video, and we'll probably do a lot more in the future. If you'd like to see more videos on medical and more advanced first aid kits, and this one I put together myself. You can buy the fancy first aid kits, but I know everything that I need and the things that I use the most. And for me, it was a lot cheaper to do this. I just need to get me a nicer bag or a bigger bag. Anyway, come back and see us again. If you like this, please hit that like button, and we would love to have you subscribe. Until we see you next time, bye. Oh, P.S. The rest of what was in with my creams and stuff, and my Tylenol and my Motrin, was nitroglycerin tablets, BC powder, which is really good for toothache pains or headaches. I also have some Peridian or Azeo, which is good for dysuria or urinary burning, and from like a urinary tract infection. Women get those a lot. I also have Benadryl and just a bunch of over-the-counter stuff, but that's some of the main things that I felt like I needed to keep on hand. And I think that's it. I also have antibiotics in another kit. I should have just kind of got everything together, but this just kind of gives y'all an idea of you know, how you could do your own kit. Leave me some comments and tell me what you would do different or what you think I'm missing in a basic first aid kit. Thank you. God bless. Till we see you again.